Worldwide, about 1.6 billion cups of coffee are consumed each day. On average in the U.S., people drink between 2–4 cups of coffee, which equates to about 300 milligrams of caffeine per day. According to Mayo Clinic, drinking up to 400 milligrams, or about 4 cups of coffee per day, is considered safe for most people. However, sensitivity to caffeine can vary. Therefore, some people may only be able to tolerate less than 400 milligrams of caffeine without negative side effects. Coffee has been shown to have both positive and possibly negative health benefits. Coffee can be a source of antioxidants that may help lower risk for cardiovascular disease, and coffee intake has been associated with better glucose tolerance in people with diabetes, too. Some research also suggests coffee consumption is associated with a lowered risk for dementia. Not necessarily. Some people may have a heightened sensitivity to caffeine in coffee that may cause negative side effects. In these cases, it may be better to avoid drinking coffee or drinking less than the 400 milligrams per day of caffeine. Side effects from drinking coffee may include insomnia, pregnancy complications, interference with oral contraceptives, irritability, rapid heartbeat or digestive complications. Caffeine metabolizes at different rates in people, which is one reason why there are conflicting effects from coffee. Genetics, certain medications and lifestyle factors can influence caffeine's effect on the body. Many people drink coffee in the morning or throughout the day to increase alertness. This is because the caffeine in coffee acts as a stimulant to the central nervous system, which help you feel more alert and may help with mental focus. One of the drawbacks for drinking coffee may be causing insomnia if consumed before trying to fall asleep at night. How much coffee and when you drink can vary on the impact of interfering with sleep. Caffeine may increase alertness 15 minutes after consuming coffee to up to 6 hours after drinking. Another side effect from caffeine may be increased restlessness, nervousness or irritability. This may especially be noticed if someone consumes excessive coffee and gets more than 400 milligrams of caffeine per day. However, if someone is more sensitive to caffeine, they may notice some heightened irritability or restlessness even after small intake of coffee. If you notice after drinking coffee you feel restless, nervous or irritable, you may want to cut down on your coffee intake. Drinking coffee may cause heartburn or stomachache for some people. Irritation in the stomach from coffee is most likely the combination of caffeine, catechol and a substance called N-alkanyl 5-hydroxytryptamates. There is also a component called N-methylpyridinium found in coffee that may actually counteract stomach acid production. Roasting can increase the amount of N-methylpyridinium in the coffee beans. Therefore, darker roasted coffee may be easier on the stomach compared to light roasted coffee. It is generally recommended children and adolescents should avoid caffeine intake. One of the main concerns with caffeine intake with children and adolescents is it's not fully known what the effect caffeine has on the developing brain. If you take certain medications, drinking coffee or consuming other products with caffeine may interfere with medication. Speak with your doctor if you are wondering if caffeine interacts with any medication or supplement you are taking. Mayo Clinic suggests caffeine from coffee may interfere with epinephrine-based medications, theophylline-based medications to open up airways and the supplement echinacea. However, some people may be more sensitive to caffeine, and their suggested intake may be less. Negative side effects from coffee can vary and may include insomnia, irritability, rapid heart rate, risks for pregnancy, interference with oral contraceptives, heartburn or stomach ache. Drinking dark roasted coffee may help lower coffee's effect of stimulating stomach acid production. The bottom line is coffee may offer some positive health benefits in moderation, but if you experience negative side effects from coffee, you may want to avoid or limit your intake.